2021. Okay. Good afternoon to everyone. This is your chair, Carmen Carter. I want to welcome some of our guests who are already here and definitely appreciate all of our members being here today. And at 12:03 now, I believe it is, we're going to proceed with the roll call. If you can proceed, clerk, that would be nice.
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Member Winton.
Here.
Member Tinsley Smith.
Present.
Member Talley.
Here.
Member Starr.
I'm here, but I'm currently in Memphis, Tennessee.
Thank you. Member Shield.
Here.
Member Randall.
Present.
Member Luckman.
Present.
Member Lanto.
Present.
Member Joyner.
Here.
Member Hughes. Member Gator.
Present, participating from Dearborn Heights, Michigan.
Thank you. Member Garcia.
Present.
Member English Barnhill.
Present.
Member Douglas.
Present.
Member Dobb.
Here.
Member Crawford.
Present.
Member Cash.
Here.
Vice Chair Roberts.
Present.
Chair Carter. Chair Carter.
Progress. Present.
You have a quorum.
Thank you so much. All right. Again, thank you everyone for being here. We'd like to now have an approval or receive a motion to approve the September 9, 2020 meeting minutes.
Move for approval.
I'll second. Sheil will second.
All right. Thank you. The motion has been passed to accept the minute as they've been transcribed. We have a few
Chair Carter, you have to call for a vote. All those in favor.
All right. All those in favor of accepting the minute meetings as recorded, please say aye.
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 Are there any objections? Extensions? We will accept the minutes as been given. We have a few special guests today with us today and a couple of presentations that we'd like to bring to the board today and all of our guests. Member Dobb has worked to bring these guests aboard. I'd like for her to introduce the first speaker, and then we can go right into it, as I know their time is of the essence and we want to get them in and then move on to the rest of our agenda today.
Thank you, Chair Carter. I would like to introduce Carol Osterberry, who's the Wayne County Chief Public Health Officer. And we have Jennifer Floyd, who is the Deputy Health Officer for Wayne County. And they're just going to speak on the impact of COVID-19 and their response and handling of the pandemic. So I'll turn it over to you, Carol.
Commissioner Dobb, thank you so much. And to all of you on this commission, again, it's just a pleasure and an honor to be able to, present here in front of you, meet all of you. I even see, an old face, Chelsea, from a project that felt like a lifetime ago, but it really was just a few years ago, working on a strategic plan. So, as we all have known, professionally, just work in the field, have passion for, public health issues and, improving health and outcomes in the community. And you tend to, run into, many of the same people, old friends and making new friends and new acquaintances. So again, thank you so much. I will, and actually just real quickly about me, I have been working in public health for well over 20 plus years. I started with Wayne County about 12 years ago, but before that I was with the Monroe County Health Department. In Monroe, I was primarily worked in the environmental public health programs. Here at Wayne, I started out with environmental public health, then moved to what you call the personal health services or clinical health as the deputy health officer, and then have moved up to the health officer position. So lots of public health background and, working, with the community and with great partners. So, and I will let Jennifer introduce herself, and then we can start on our presentation.
Hi, certainly thanks for having us. My name is Jennifer Floyd, and as Carol stated, I'm the Deputy Health Officer here at Wayne County Public Health. Prior to this job, I worked at Oakland County, and prior to that, Detroit Health. So I've been in public health for quite a while as well. I'm also very passionate about these topics because I was a women's studies major in undergrad. So I was really excited to be invited to speak here. So we're really excited about this presentation, and thanks for having us.
Great. And we'll get started. As everyone said, everyone's time is very precious these days. So just the pandemic response in Wayne County, and then that impact on women. And just to clarify, so the Wayne County Health Department, our jurisdiction is all of the communities in Wayne County exclude outside the city of Detroit. And you can move on to the next slide. So we started, I still remember the first night when I got a phone call from the state of Michigan saying that there was a plane coming in from Wuhan, China, and what was I going to do about these passengers? So with that, we ended, really it's public awareness and education, both internal and external. We did those briefing reports, even, immediately with our staff, with the executive team. Then that rolled into, that COVID-19 testing. It was all about testing. We geared up quickly to have, testing, health department, and then have those drive-through testing events, great partnership with us, state of Michigan, and even the Michigan National Guard. And those events were very well attended. And, we got a lot of residents in Wayne County tested, which then helped us as the health department know where we strategically needed to, find the cases and, have people self-quarantine. And we also really worked with distribution of personal protective equipment, obtaining it, storing it, getting everything from, I'm sure we all thought about, the whole disposable wipes and gloves and, everything that we all geared up for, the face masks and, the face shields. So we worked with that in getting those items and then getting them distributed out. We had a great project both for face masks for adults and for children, especially worked with our regional education system, for the schools. Next slide. Then research and analysis. I mean, with the pandemic, you do look at, things that happened in the past and, what would be the best way for us, again, to really respond to what we were seeing in Wayne County and using the data, as we were planning our strategic, operations and moves. And then the contact tracing. And as I said earlier, the case investigation, contact tracing, and the testing, so that when there was an outbreak, we contained it and educated back, the residents and employees. You need to stay home. You need to, if you're sick, don't go into work. That was all part of that outbreak prevention. Next slide. Then with the vaccine, we knew vaccine was coming, even though we were doing all of those other pieces. So it was plan, prepare, and then we started administering our first vaccines in December. And because we had done so much with our drive-through, especially with, those testing sites, we were, we're going to be doing something that I think many health departments never even had thought about, was drive-through vaccines. And God, we did it well. Again, I still vividly remember those first days here at our main health department office. We actually have a very large garage that has 2 drive-through bays. I was the one in one of the meetings said, wait a minute, couldn't we just raise up both of those garage doors? And we did it. And when we got to the point of pretty much over 1,000 people a day. That was pretty much our top capacity here at the main health department. And I still, you can feel my energy and pride in that. It took all of us working together, and we got a lot of people vaccinated, those right initially, the first responders, EMS, and then those healthcare workers through our drive-through here at the Health Administration building. Next slide. So we are talking about the data, and data, we use these graphs really to show breakdown male and female. So as far as those positive cases, it almost, pretty close to a 50-50 split, males and females. So for our Wayne County cases, we had both males and females were affected about the same. Next slide. Oh, okay, sorry. And this is about deaths. Now with the death rate, very interesting, very different picture. Many more males than female as far as those who, sadly, did not make it through their fight with COVID. And also with the age, we can see, and many of us know that it was that over 75-year age where we were seeing the deaths. And that then led to why, when that vaccine came out, they were, those seniors were also very prioritized for those first rounds of vaccines. Next slide. We all start talking about, COVID and then the variant cases. Again, the variant cases, we can track that data by gender and age. And again, females and males, virtually almost 50% there. And the age range for the variants, you don't really see on this graph. You have that 19 to 29-year-old, but then you also have the 50 to 64-year-old. So we really didn't see with the variant, real big, different groups that were being affected by the variant. It was pretty evenly spread throughout both gender and age. Next slide. Breakthrough cases, many people ask us always about breakthrough cases, and the number of breakthrough cases is less than 1% of those who have been vaccinated. And this slide is showing you, though, as far as the age for breakthrough, we have that data more 50 to 64-year-olds. We don't have the gender on that, but we do know that between 50 and 64 was the age group. But again, the number of breakthrough cases for the number of vaccines we have given, that still remains at less than 1%. Next slide. So then fully vaccinated, which is 2 doses of vaccine when the vaccine is that 2-dose series, or the 1 dose of Johnson & Johnson. And here we show females are, I think, maybe a little better about making sure they follow doctor's orders and get both doses. So our females have done a little better on getting both doses, but we're doing pretty good, both females and males on that. And again, that age range of the 50 to 64-year-olds, they really followed, the data, and they came out, they got vaccinated, and they got fully vaccinated. We need to follow, as I've heard many people say, we need to follow what our elders, but I guess I'm in that 50 to 64 age, so maybe. Next slide. Then lessons learned. Next slide. So when we started this, yes, public health, we respond, we know what we're doing. There's always challenges, at the beginning, and many people have always heard, that whole communication. So some inconsistent messaging, maybe a little frustration with staff and volunteers, registration. We had to work out those details, both for the testing events and the vaccine. But to me, as the director, as the health officer, you go into this knowing there are going to be challenges, and then you step back with your team and say, okay, what went right, what went wrong, and what do we need to do to adjust? And we did that, just very well at the beginning. Next slide. So how we overcame those things. We really incentivized our volunteers, and we were, a lot of college kids, and again, a lot of just, community members volunteered, especially for the testing events and for the vaccine events. And we contracted with third-party staffing agencies, clear communication, with our COVID response team, and daily meetings, to make sure everyone was on the same plate. What was the plan for the day? Dividing up those registration roles so that there would be a complete form, and then that steady flow of traffic, like I said. And we actually then also worked on, we got software to verify the scheduled appointments, and then everything going directly into, and MICR is the Michigan Immunization Care Registry, which is where all of our immunization records go right into a state centralized database. So as I said, they were challenges, but we overcame them and have got very successful, especially with both the testing events and the vaccine events. Next slide. So there are people out there who just feel, anti-vaccination, that's their, personal opinion, misinformation. So we have been developing, just fact sheets and information. Earlier in the summer, we had door knocking campaign that we had, again, frequently asked questions, and we had myths versus the truth. So we really have worked to get that communication out on here's the fact, here's the myth, here's the fact, here's the myth on getting vaccinated, for both the residents, for healthcare providers. We got the information out to them to help with their patients. So just that consistent public health message, and making sure the facts were what was getting out into the public awareness. Next slide. So as CDC recommends, we receive results or alerts from this health alert network, and people who are pregnant, trying to become pregnant. We again, like I say, we get these facts from the Michigan Health Network and also through CDC. CDC aligns those with professional organizations, who are pregnant, and benefits of vaccination for both pregnant persons and their infants. We really worked on that because that's where we were hearing a lot of well, I want to get pregnant. I am pregnant. I've heard I shouldn't get the vaccine. This is why. So when we get the feedback, then we go back out with good public education, the facts to, unmystify or, squell those myths. Next slide. And at this, I am going to turn it over to Jennifer for the next part of the presentation.
Okay, thank you, Carol. And I'm looking at my counting the minutes, so I am conscious of the time, Commissioner Dow. So, okay, as far as what lies ahead, we know we're at now. We're obviously providing boosters and third shots to individuals who are eligible at any of our Wayne County public health sites, but people can also go anywhere the vaccine is available. Also, we are waiting on the approval for vaccine for children 5 to 11. That's the next step, the next drop down of age. So that'll be really exciting. We are already vaccinating in the schools, but of course that'll bring us to the elementary schools. Now we're just in middle and high school. So that's something really exciting for us. Also, next slide. Okay, next slide. Okay. So the good thing about working in human service is predominantly female driven. So we often have a lot of female representation at all the tables, including leadership. So that is very helpful in decision making and response planning. We often have a ton of females, people who are caregivers, whether it's of small children or older parents or adults. So that's pretty helpful. That's kind of a built-in situation. We're already at the table. So next slide. Okay. So pretty much we're showing that the ratio of infections of populations are still just about equal when it comes to men and women. And although it fluctuates, as Carol stated, it's pretty comparable. Okay. However, women do disproportionately suffer from the impacts of pandemics and other health inequities. So that's not new to COVID-19, as well as the racial inequity and all those other things that have been brought to light that we in public health were already well aware of as far as inequity in service. One of the big things we made a point to do in response to the pandemic, the offering of in-home vaccinations. When you have children you're responsible for, elderly people, different obligations, even if it's after hours on the weekend, we really pushed a lot of our in-home vaccinating to make it convenient for people, not just women, but women tend to be more likely to be caregivers, to come to the home and vaccinate in the home. So that's something we're really proud of, that effort, working along with EMS, and also now our nurses are providing that service. We're really excited about that. But that was one of the things that was discussed in our planning for populations like women who are more vulnerable, things we can do to make it more convenient. To put a kid in a car seat and drive somewhere, it's a to-do. So next slide. Okay, so I know this is a lot. So we did send this presentation out so that everyone on this call will receive a copy, but just a few of the factors that we often consider when we're doing our planning, things that make women just so much more vulnerable to the impact of this. We did talk about vulnerabilities such as poverty, being a caregiver, the socioeconomic impact of being a caregiver and not having that income. A lot of women are caregivers, yet they're unpaid. And also a lot of women work in fields that were completely devastated by the pandemic, whether it's working in retail or food management or even the healthcare sector itself. So women were very vulnerable to this. Also the mental health piece, as far as higher anxiety levels, depression, PTSS in women, all those things women are disproportionately impacted by. And again, I apologize for breezing through this. I do not want to cut over too much into Director Ferrarazzo's presentation, so I'm being very mindful of that. Next slide. Also, just to further on the previous slide, the biological factors, hormones, particularly women who are pregnant or individuals going through menopause, there are certain things that we're just not as knowledgeable about just yet, and those things are very impactful as well. Also, the domestic violence and human trafficking piece, and this also goes for not just women, but children as well. During a time where everyone was sent home to shut down, kids weren't in school, certain abuses that would have typically been noticed and reported, those opportunities are no longer there. Human trafficking is on the rise because of the vulnerability, people being at home on their computers. That could be a whole nother presentation about the human trafficking piece, but certainly those are factors we considered as well as far as our planning, things that make females more likely to be disproportionately impacted by COVID-19. Next slide. Okay. So similar to what I just stated about the school situation, also a lot of teachers, people who work in education are females. They were also impacted by the pandemic, being sent home and also still being caregivers, having to manage both. So that's also a socioeconomic impact where certain individuals had to actually leave and resign from positions because of the inability to manage both without that additional support. So, and also women being, oh, that's fine. Nope, go ahead, go forward. That's okay. Thank you. And also the things that are something to consider even when we're not in a pandemic, women having a longer gap of unemployment on their resumes. That's something certainly when we're out of this pandemic, which I hope we are out of this pandemic someday, that'll be something that women will have to deal with as well, those huge gaps of unemployment that they're more likely to have on their respective resumes. And again, we touched upon domestic violence, that confinement factor where people are at home confined with no one to witness, no one to see the signs, to offer support. Those type of things are inherent when you're in confined spaces. Okay, next slide. Okay, perfect. Okay, perfect. But again, we did send out a copy of this presentation for everyone to view later for questions. I don't know if anyone has any questions now. We're certainly here to answer.
Thank you so much for that presentation. That was awesome. Chair Carter, do you want to go into Denise Ferrarazzo's presentation now and then do questions for everyone? Okay.
That will be.
All right, great. And I would like to introduce the City of Detroit's Public Health Officer, Denise Ferrarazzo. I hope I got your title correct. And this is going to be of particular interest to me because, being a Wayne County Commissioner, I've really only heard from Carol and her team. So we don't cover the city of Detroit. They've got their own health department. So I will hand it over to Denise.
Thank you so much, Melissa. It's really a pleasure to be here. I just have one simple request. So first, I don't create PowerPoints. So I apologize. That takes too much time. So I'm just going to talk to everyone here, but it would be really helpful if the 36 people that are here, if you can turn on your camera, because I love to have a conversation with people. So I understand if you can't, that's fine. Or if you're sitting there eating your lunch, that's fine. I get it. Mine is sitting over here. I'm going to finish it as soon as I'm done. But I do want to have this general conversation. So let me start. Let me start my clock because I tend to be a little bit long-winded. Let me just take a step back because our first case in the city of Detroit was right around March 11th of 2019. And that same day or the day following, the mayor and I had a press conference where we shared the information with Detroiters based upon what we knew. And we didn't really know a lot at that time. We just wanted to make sure that Detroiters had enough information, and we wanted them to be equipped because we really didn't know what was going to lie ahead. And we were looking at other states and other counties because we were literally a few weeks from where they were, shutting things down. And so we acted swiftly. So over the next 20 minutes or so, I'm going to talk about where we were, where we are, and where we are going. And if there's time, I would be open for any questions. So let me first start with a summary of how we handled the COVID-19 pandemic. So as I mentioned, it was extremely important for the mayor and I to focus on providing Detroiters with information. And we partnered with local health systems. That was number one. So we partnered with Henry Ford Health System and DMC. And we rolled out a very robust drive-through at the local state fairgrounds because we wanted to get Detroiters access to testing. And so we partnered with the local health systems, we got their staff involved. And not only did we open the drive-through up for Detroiters, but also for anyone in the surrounding counties. So Wayne, Oakland County, Macomb. And we wanted to make sure that everyone had equitable access to testing. What we first noticed was, back in the day, as they say, you had to have a doctor's note in order to, I don't know if you guys remember that, but you had to have a doctor's note in order to get a test. Again, we were learning things as it happened. And so we found that Detroiters didn't have access to primary care providers. And so we made sure that we reduced that barrier. We actually eliminated that barrier by making sure that if Detroiters had symptoms, they could partner with an FQHC. I think we lined up about 20 FQHCs, federally qualified health centers. And we said, look, if a Detroiter calls, then we want to make sure that they can get a doctor and they can be seen quickly and get their prescription. And then we can handle taking them over to the drive-through. And it happened beautifully. We set up a physician referral center overnight, had our website launched very quickly. And so Detroiters had access. Then what we noticed was that Detroiters may not have had transportation. So we also eliminated that barrier. So we had this, really robust drive-through, but if no one could access it, then what service would it do, right? So we partnered with local cab companies and we said, hey, look, if you've got symptoms, if you're a Detroiter, give us a call. We will not only give you a doctor, but we'll also partner with a cab company, pick you up from your home, take you to the drive-through, get your test, and then drop you off back home. Again, we wanted to put Detroiters first. We were doing about 1,000 tests per day at the drive-through. Another thing that we did, though, not only did we focus on Detroit residents that were mobile, that were living, in their homes, et cetera, but we wanted to focus on our most marginalized communities, and that's our homeless shelters as well as those who are in nursing homes. And so we partnered with Wayne State University medical students because at this time things were shut down, and so the medical students, they wanted to help out. And so we partnered with them and we went out into homeless shelters. We went out to the nursing homes and we tested everyone, both the residents as well as the staff. In fact, we tested over 26 nursing homes in about 10 days, which is about 2,000 tests. The reason why we started with our most marginalized is because, especially for our seniors, they are the backbone of the city of Detroit. They really are. And we did not want to forget them. And so of those 2,000 tests, we found that about 25% of our nursing home residents had COVID. That was bad. And so what we did was we found out that we needed to partner directly with nursing home directors. They came to us. They said, what do we do? We don't know what to do. We don't know how to cohort our staff or our residents. We're not sure how to get PPE. And we said, look, we are the Detroit Health Department. We're going to back you up. We're going to be your advocate. So there were many, many nights where my team and I were here at the health department. We were on the phone with the federal government trying to make sure that PPE was delivered properly to these nursing homes and also the homeless shelters. We want to make sure that they had a voice. And so we continue to do bi-weekly testing, giving them enough PPE that we were able to say within a few months that the infection rate decreased from about 25% to 5%. And so, that was considered a success. And as we know too, and I don't have to tell this group, but nursing homes are congregate settings. And COVID was spreading rampantly throughout nursing homes as well as with the homeless shelters. So not only do we focus on our marginalized communities, but we still needed to make sure that we provided exceptional communication to Detroiters. Everything was shut down. So we could not, go to Cass Tech and go into the auditorium and cram people in there and provide knowledge. We couldn't do that. So we had to rely on the power of social media. And Mayor Duggan has always been pleased that I'm a millennial. Now, I know I may not look like one, but I am under 40 years old. And I can claim that for another 2 more years. And I and my whole entire team, we are dedicated to Facebook, Instagram, TikTok, you name it, we're on it. And so that is what we did. We pumped out a lot of Facebook messages. We had live Facebook lives, Instagram lives. We partnered with influencers in the city of Detroit, Royston 95, some yogis as well, to get the word out there. We made sure that we message on multiple levels to multiple generations because not everybody was tuned in to Fox 2 or Channel 7. Not everybody was watching the press conferences that were done on a daily basis. So social media was really, really powerful. And since then, the mayor had actually asked me to do a presentation on how to create a mask because we didn't have a lot of masks. Now there's like an abundance of all different types of masks. We have the colorful ones, we have the blinged out masks, but at the time we didn't know how to create our own masks. So I created a mask video, ended up going viral on YouTube. It was shared or seen more than 600,000 times, which I thought was great. What that meant is Detroiters were screaming for more education. And so since that time, we've hosted, I believe, about 500 or so telewebinars to give information out to Detroiters. We also hosted a 24/7 telephone line so the Detroiters could call and ask questions about COVID, and it has been pretty successful. So not only did we focus on, again, our mitigation strategy for nursing homes and made sure we had our drive-through and we did our communication strategy, but we partnered with trusted leaders in the community. So it wasn't just Mayor Duggan and myself and the health department, it was a collective effort. So by the time the vaccines rolled out, now we're talking about December of last year, we partnered with trusted leaders in the community. So it was pastors, it was teachers, it was business owners, and we made sure that we encouraged them to not only get the vaccine, but to tell their membership, tell their residents, their neighbors to get the vaccine. And so right around January or so, when we opened the doors to kind of our first responders, to our pastors, we also opened the church doors. So we partnered with local pastors and we asked them to help us set up mass vaccination clinics because the churches were closed. I know for me, I have not gone to church, and this is really embarrassing, but in the last probably 2 years because church has been closed. And so I've been going online, but these buildings were just kind of sitting there vacant. And so when we had the pastors come down to the TCF Center to get their vaccine, we said, go back to your members. open up your churches. And we, as the health department, we will partner with Henry Ford Health System and DMC, and we will bring nurses directly into the sanctuary. And that's what we did. And it was really successful. And I believe, I can't remember what it was called now, but I think it was Senior Saturdays. And we were vaccinating about 500 people per day. And these were seniors. And that was wildly successful. Since that time, our message has still been the same. We encourage everyone to get the vaccine. We don't want them to wait. We have developed an incentive program called the Good Neighbor Program, which encourages Detroiters to bring their neighbor directly to any one of our vaccination sites, whether it's the TCF Center downtown or a church or a rec center. That person who brings their neighbor gets $50 for the first shot and $50 for the second shot. So we've turned some Detroiters into entrepreneurs, because we see a couple people, at the same time, bringing more neighbors back to the TCF Center, which is great. We want to applaud that. We want to encourage those Detroiters. So that's kind of where we are right now. I mean, our data has shown that about 46% of Detroiters have taken advantage of this life-saving vaccine. We know that's not anywhere where we need to be, but we are on a path. And the question that I keep getting almost every day is, are you tired? Are you worn out? Are you just throwing in the towel? And I know Carol gets that same question too. And the answer is straight up no. We are not letting, we're not letting our guard down. We are energized, we are hopeful, and we want to make sure that we continue to provide equitable access to this life-saving vaccine. So I kind of shared a little bit for the last 11 minutes now about where we were and where we are. Let me give you some facts in case you don't believe me, right? The data really speaks for itself. So to date, the number of cases that we have had so far since March of 2019 is 58,801 cases of COVID-19. And that's inclusive of breakthrough cases. Unfortunately, we have had one too many deaths. We currently have now 2,397 Detroiters who lost their life due to COVID. The number of fully vaccinated is 211,349, and we continue to add to that number. Again, we have multiple sites all across the city of Detroit. Access has never been a problem. The number of variant cases is 887. I'm sure Carol has shared with you that the majority of all of our cases in the city or in the state of Michigan, especially in the city of Detroit, are Delta variant. So it's about 98% of all of our cases. And we know the Delta variant is strong. It is spreading rapidly. So it's right around 887. For the gender age breakdown, again, please don't ask me to create a pie chart because I do not know how to do that. So males, 44.6%, females, 55.3%. So when we're looking at vaccinations, it's right around a similar split between male and female. For the highest vaccination rate, it's between 50 to 64. So for those who have received their vaccination in the city of Detroit, about 30% of those individuals are between the ages of 50 to 64. And of course, we know this, the lowest vaccination rate is amongst the kids. So 3% ages 12 to 15. Now, this is actually not on my little cheat sheet of notes, but I can tell you that the millennials, which is my generation, we are really part of the problem. So when we look at those who were unvaccinated, 60% of those who were unvaccinated in the city of Detroit are under the age of 40 years old. And under 40, we're healthy. We don't really have a lot of chronic diseases. And so I know my message has been extremely clear from the very beginning. COVID is no respecter of persons. COVID does not care if you are white or black. COVID does not care whether you are overweight or you are underweight. And COVID does not care whether you are in your 80s or you're in your 20s. And so we really want to make sure that the millennial population, of course, steps up because we've not been vaccinated. So some of the questions that Melissa, you sent me, I want to make sure I respond to those in the next few minutes that I have. What have been the biggest challenges that we have seen at the health department regarding the pandemic? I mentioned that. So in the city of Detroit, 40% of Detroiters do not have access to high-speed internet. So when we launched the drive-through, when we launched our scheduling, when we launched our phone line, we did not really focus on the internet. We made sure that there was one phone number for Detroiters to call, which is 313-230-0505. And instead of going online to schedule their appointment, they could just call one number, and they would tell the operator where they lived and their zip code, and the operator would tell them, hey, here's the nearest vaccination site. So that was incredibly helpful for us. I also mentioned too about the transportation challenges and not having a provider. So we were able to quickly eliminate those barriers. And I think right now, the main challenge is vaccine hesitancy. And I would even probably update that now that we are in October of 2021. It's probably not even vaccine hesitancy. It's more like vaccine apathy. I think people are tired of hearing the same message about COVID. I know many of my friends have even said to me, well, I haven't gotten COVID before. I'm probably not going to get it. So what's the point of getting the vaccine, or what's the benefit of getting the booster shot? But of course, they know that I have yelled at them multiple times about getting the vaccine. And so thankfully they have. But there are many Detroiters out there who are still really hesitant, or they're apathetic about getting the vaccine. And then, of course, as I mentioned before, our goal continues to be equitable access to the vaccine. As other cities were shutting down their operations, we did not shut anything down. We kept going, and that's our plan going forward. One other challenge that I didn't really mention is that for those Detroiters who didn't want to come to any one of our sites, we said, well, that's okay. We will not allow that excuse, because we can come directly to you. So we've used our mobile units to go out into the community. We have 2 mobile units right now, and that's been wildly successful as well. They can give us a call, and within about 24 hours or even that same day, a nurse can come directly to them and vaccinate not only them, but everyone in their household. We're also going door to door, literally old school method, knocking on doors. That's actually the traditional public health approach, 50 years ago, going door to door. And we've knocked on 300,000 doors so far. And we are talking to people individually to say, it's really important to get the vaccine. Here's why you should get it, and here's how you can get it. And if you want, I can make a phone call for you. So that has been great. So we've actually eliminated a lot of those challenges. So the next question is, so what challenges have not been overcome, and what are your plans to resolve? COVID-19 is really not going anywhere. It's really here to stay. We've normalized it. My goal as health officer is to really get back to traditional public health. We have over 40 programs at the health department, everything from our WIC program to immunizations, to our environmental health, to multiple programs to help Detroiters thrive. So I really want to get back to making sure Detroit knows that there is a health department that is there to advocate on their behalf. So that's really my plan, to really get back to traditional public health. What are some processes that you would do differently if you knew now? So it's funny, Melissa, when I got this question, because Mayor Duggan has been asked this question repeatedly at press conferences. And so I'm gonna like steal his answer, which is, I don't know that we would do anything differently. We literally have done everything possible. In fact, I've spoken to Carol and other health officers all across the country. We're all doing the same thing. So we come up with a new idea, and we think it's never been done before. Oh yeah, it has. And so in the city of Detroit, again, not only are we going, so we're going door to door, we're going to people's houses, we're offering multiple locations all across the city. We are doing so much. And so access is not an issue. Now we have to focus on up here, right? And so providing lots of education and outreach to make sure Detroiters get the facts instead of fiction, instead of going on social media and coming up with their own ideas about how the vaccine will cause your whole entire body to be magnetic, or the vaccine will cause you to, not be able to have children, or the vaccine may cause you to have horns and grow a third eye. We're trying to make sure that we debunk those myths. So in answer to the question, I wouldn't do anything differently. I think, my teams have done an incredible job, and that's what public health is designed to do. We are designed to make sure that we take care of a population, especially when there is a disaster such as this one. How's the health department fighting the anti-vaccination misinformation campaign? Again, we are getting out there. We're making sure that doctors, like clinically trained MD, and these are not Facebook doctors. These are doctors who work at Henry Ford and DMC and right here in the health department, and they are having one-on-one conversations with Detroiters, and they are hosting webinars to make sure the information is out there. And then, of course, we have our public service announcements, our YouTube videos, Facebook Live, Instagram, things that I've already mentioned before. What lies ahead? And again, Carol mentioned this for Wayne County, so it's not really different as much, but we're focusing on the booster as well as the third shot. And there, we have to make sure that people understand the difference. And really, there is no difference between the booster shot and the third shot. They're exactly the same. The only difference is who is eligible. And so we've been making sure people are understanding what that message is. And again, Detroiters can go to any one of our vaccination sites to get their booster and their third shot. We are anxiously waiting for the vaccinations for those who are between the ages of 5 to 11. We are optimistic that it's going to happen relatively soon. And we've been working really closely with DPSCD and their administration to make sure that when the vaccine is available to their students, we are there to be extremely supportive. And for me, in my last 20 seconds, it has been an honor speaking with you and sharing a little bit about what we're doing in the city of Detroit as it relates to COVID-19. Our work is not done. We have plenty more work to do in the city, and we are resilient, we are hopeful, and we are not going to stop. And so with that, I will turn it back over to Melissa.
Thank you so much, Denise. That was incredible. I'm so glad that we have two strong, incredible women at the heads of our health departments, both in Wayne County and the city of Detroit. So amazing presentations. Thank you again. I will turn it over to Chair Carter.
Yes, thank you so much. Yes, we really did enjoy your presentation. We have a few items still on our list. So I'd like to open it up, just maybe 2 questions from our membership, or even our membership. And if you can stay around after we get to the end of our meeting, we do open it up to the general public who may have questions. So we can just get 2 questions just so we can get through our agenda. Raise your hand, please, and be recognized by the clerk.
Member Lanto has her hand raised.
Thank you
Go
so
ahead.
much for spending your time today with us. As a former public health employee, I just want to thank you and your teams. I know that you're working tirelessly to keep everybody safe, and I definitely commend you for the long hours and the passion involved. My question is, what could we as the Women's Commission do to support the efforts that you all are working on?
So I can start, and then Carol, pass it over to you. I think, this body of women seems to be so powerful. Anytime you put women into a room, we can move mountains, right? So we can change the political agenda. We can really move and drive people forward. And I think what's really important to me as health officer for the city of Detroit is that I work with all of you to share your vaccine story, because I am really, I don't want to say I'm far removed, but I don't get a chance to sit down with residents one-on-one, but you all do. So if you could share your vaccine story with your family, with your friends, with your neighbors, you're going to move mountains better than I could, because you have that personal relationship with your peer group, with your community group, with your churches, with your sorority group. So that would be my ask, is to take a look and listen to Carol's presentation and mine, and have those one-on-one conversations so that we can have more Detroiters vaccinated, of course, also in the Wayne County.
Thank you. Do we have one more hand?
We do have one more hand from member Dobb.
Recognize that.
You know what, I'm gonna ask the same question to Wayne County.
Yeah, and thank you, Commissioner Dobb. And actually, much of what Denise said, and through this also, Denise and I have worked lockstep. How many times, you know, many of you don't even, it's like City of Detroit and Wayne County, and, you know, and as Denise was saying, it's getting the word out, the education, especially because many of that, you know, a lot of that vaccine hesitancy is with, you know, women of the childbearing age. And, you know, and like you say, you know, I like the way Denise put it, telling your story. You know, when I go places and all of a sudden it's funny, I'll have people, oh, you know, they ask me all this. And then invariably there's a couple that, you know, I was at a couple, so, you know, just picnics this summer. And I, you know, sat down and quietly just kind of talked to some parents who were, well, I'm not sure, blah, blah, blah. And I'm like, well, you know, here, you need to look at all the facts and make your best decision. And, you know, that's how I approach it mostly is I'm all about, you know, being vaccinated and everyone being safe. I get it. If you're if you just have questions, hesitant, ask me, ask your primary care physician, and just, you know, getting that consistent, good, you know, the correct information out there is, I think, just the best. And as Denise and I, you know, we really, when all of this started, her and I both got that phone call, Super Bowl Sunday from the state of Michigan. We both were like, did you get a call? Did you get a call? You know, and that's when it started for us. And we, you know, really kind of, you know, in a way almost met each other and worked so closely even with all of what we did for the virtual binder for the back to school a year ago, you know, and how things have changed now. And it's just really one big thing. And I know this isn't really even answering quite your question, but I also think another part that has come out of this crisis, out of this pandemic, is the strengthened relationship between the Wayne County Health Department and the City of Detroit Health Department. And I'm so proud of it. You know, like I said, Denise and I are, you know, we're on first name basis, and just that's been a real positive because both of us working together, as Denise said before, our whole community, you know, whatever disease it is, it doesn't know the boundary of Detroit and Wayne County. And so we're just working so closely together and with all of you on those good, consistent messages, and, you know, keep that conversation up.
Right.
I would like to.
Any, oh, I'm sorry. Are there any programs that the county and same with Detroit that are specifically targeted toward women that maybe this commission could do anything to help boost that you know, I think that we could work on to get to strengthen that. Maybe we can I don't know, maybe there's, and I know we don't have time to really dig deeper into those today, but maybe at a future date, if you can just throw out a couple things that there are, the existing programs.
So let me just speak 2 seconds about Sister Friends, and I can share that with you, Melissa. I can send the information to you, but Sister Friends essentially is a program designed to help women who are pregnant and women who need resources, women who maybe need to be taken to their doctor's appointments, women who just need to talk and say, look, I'm pregnant and I need some help. Just walk me through. And it is really, it's a mentoring program. And so we're always looking for women to be mentors. And I can, again, send you information. We have about, I think, a couple hundred women who are in that program.
Okay, great.
So wrap this up at this point, and obviously we need to get together with some of our guests, member Dobb, and make this a bigger and more meaningful operation, perhaps between us and others who are sisters. I'd like to say that it's nice receiving information directly from people who are working to fight the COVID issues that we're having in our communities. And so thank you for that. It really is going to make a difference if we all do our part. I would like to challenge all of our members and those that may be listening to us to add a banner to your Facebook page or your social media page to say, I've been vaccinated, if that is the truth. And that would definitely be an impact. And let's talk about that offline, because I do want to wrap up this
Madam
particular
Chair,
So I'm
Madam
sorry.
Chair,
Go ahead.
this is Commissioner Monique Baker McCormick. I just wanted to chime in just before you end the conversation, and to both the health officers, I want to commend you on all the work that you do. I am the chair of the Wayne County Health and Human Services Committee. And one of the questions, the last questions I wanted to ask of Denise is if there are any efforts, because we know that African Americans, and I represent Detroit, Northwest Detroit in particular, if there are any initiatives that you are working on to look at the determinants of health, or to help the citizens of Detroit and the health related issues that we are plagued with.
Absolutely, Commissioner Baker, thank you so much for your question. Even before my arrival, there was always an initiative, there was a drive to ensure that the health department was at the forefront and ensuring that all residents of Detroit had their voice heard, and we were able to develop programs based upon their needs. There is something called the Community Health Assessment, which is now available on our website. It was created in April 2019 under the previous health officer, Dr. Jonay Caldoun. Essentially, it looked at about 6,000 or so residents and asked them, what does a healthy Detroit look like for you? What are you looking for? What are your needs? And so we took all that information, we put together an assessment based on each district, and that is available now on our website. And Commissioner, I'd be happy to send that to you, but the work doesn't stop there. That's just an assessment. Now we're working on the Community Health Improvement Plan, which looks at what Detroiters wanted. And based upon our capacity of the health department, as well as the partnerships that we have with the community, there are a few areas that we want to specifically address. And so all that information is available on our website. But yes, this is the responsibility of the Detroit Health Department, and we take our responsibility seriously.
Thank you. Thank you, Madam Chair.
Thank you so much, Commissioner.
Madam Chair, if I may say a little something.
Real quick.
I had an opportunity, Mrs. Razzo, to congratulate your husband last night at a Zoom meeting, and I'm very honored to have the opportunity to congratulate you on your 3-week marriage. Congratulations. You have a very nice husband. Thank you and congratulations.
Thank you so much. Thank you.
All right. Again, if any of our guests would be so kind to stick around if you have the time, we really would appreciate it, because I'm sure others have conversation that could help us all be a better community in terms of averting this COVID-19 by getting vaccinated. So we're going to move ahead here. And by the way, Commissioner Baker McCormick is the person or the commissioner who recommended me to this particular commission. So I do want to thank her, and I thank you for helping us out by joining us with those comments today. So we're going to move right on to our unfinished business, and there being none, we're going to skip over that one and go to any new business. And because of our time constraints, if isn't really anything pressing, I would like to maybe go past that as well. Does anyone have any new business that they think is critical and saying right now? All right, well, thank you. So let's move on to our ad hoc committee, who has been working diligently and has concluded a document that talks about our core values, mission, and vision committee. If we can bring that up, if the chairperson, I know the chairperson, Commissioner Lanto, had to leave at 1 o'clock, so I don't think she's here. But the vice president is the vice chair of that committee, Dr. Randall, is here. And please go ahead with your presentation about what the status is and where we are with solidifying those things that we really need to put in place.
Madam Chair, does anyone have a copy of the document to show the members? The copy, the minutes from our meeting that shows what we how we finalized the core values, vision, and mission. They would need to see that.
I can
would
pull that up if you just give me one moment.
And while she's doing that, go ahead and tell us, give us the names of the individuals that work with you, with this group to make this.
Chair, I would have been prepared had I known I was going to be the one presenting. So you will have to give me a minute. I don't have that at my fingertips. Let's see here.
Good afternoon, Member Chair. This is Member Crawford. If it's okay, if possible, while you are preparing to gather the information, is it possible that myself and Member English can move up? We only have like 2 minutes.
Absolutely, go right ahead. Thank you for that suggestion. Well received.
Thank you very much. Hi, everyone. Good afternoon. This is Member Crawford. We have been, it's a few of us been working. I know some people, our schedules have been so busy, but to those who I've had the opportunity to speak with, thank you so much. What I did was I was able to call around to a few places, based on a few of the recommendations after speaking with some of the members, just to get a general feel and idea of what's going on in our community. And unfortunately, right now, we're still in the middle of a pandemic, and many restaurants are understaffed. And so it's been a bit of a challenge to find a location that could accommodate us with a reservation. However, today, like right before the meeting, Bahama Breeze in Livonia, Michigan, said that they possibly can accommodate us up to like 12 or 15 people, but they could possibly do more based upon like the RSVP. We can get them an accurate number. It's off of Haggerty Road. They called and they were like, send me a reservation link that said, yes, they could possibly accommodate us. So they're looking, I know we spoke about this before, but this would be just a general meet and greet, quick meal. If anyone's available next Friday, the 22nd of October, we can just mix and mingle and have a quick bite to eat from 5:30 possibly until like 7:30. Again, they're holding a spot for 12 to 15 people. We know that it is a short notice, but we did mention a couple dates at the last meeting. But we were thinking because of staffing, I spoke to Member Ryan today, and we also came up with a great idea. Member Ryan, if you could come on really quick and state a wonderful opportunity for all of us for the holiday season.
Sure, no problem, Summer. And thank you for giving me a phone call and working together on this. So I work for Olympia Development, and that is the arm of the Illich family that builds the assets. And so I have access to suites in both the Fox Theater and in Little Caesars Arena, as well as Comerica Park. I am hoping in December, we're looking at the second Friday in December to host a meet and greet in one of the suites in either the Fox Theater or in LCA. And if it's at LCA, it would be potentially for a hockey game. And if it is at the Fox Theater, depending on what show is there, something around the holiday season. And so I will follow up with Member Summer to lock what we decide to do down. But I will be able to provide a ticket to each member that will be emailed to you. And then we would have food and beverage in the suite to mix and mingle. And I figure this is just an easier way for us to get together and meet each other and be in a space where we can talk and just really share our ideas. So more information will be forthcoming regarding that. But that is what we've worked on so far.
And also, for anyone who would like to meet with us, and we'll send out an email too. If anyone or if whoever's available next Friday, which is October 22nd at 5:30, I'll give you the address, but we can put it out as well. But it will be location of Bahama Breeze at 19600 Haggerty Road in Livonia, Michigan, which is, I believe that's between 6 and 7 Mile Road off of Haggerty, but it is a Bahama Breeze. So that's what will be at 5:30. And the reservation is under my name as well as the Wayne County Women's Commission. So either way, we'll be there. Hopefully we can see some beautiful faces in the place. That's it. Thank you.
Thank you both. Do you think it's possible we can maybe do an Eventbrite for that particular Bahama event, just Bahama Breeze event that I think will give you a clear list of people that are available? Is it possible?
Yes.
We can, okay, and
yes,
then that.
and then that way we can get we can see, we may have to have another member maybe ask for another reservation, but so far they've been very accommodating to us. So thank you.
So I'm excited about the news of both those. Look forward to it. I'm sure the Women's Commission will too. I'll be happy to participate and get to break bread and meet for the first time face to face. So thank you so much for that report. Now, is there anything else to add to that before we move on, or we move back actually to the update from the core values and mission and vision statement? All right. So hearing none, are you prepared now, Vice Chair Randall?
I had the paper. Oh, here it is. Okay. Yes, I'm ready.
Okay, go right ahead. Where you are.
Okay. On behalf of the chair, Molly Luckman, I'd like to thank the committee, member Latanya Gator, Tina Talley, and member Linda Shield for participating. We came to a conclusion within 2 meetings. The first meeting, we put together the input that the members had given us on the on a Google Drive, and then there were some members that added information at the actual meeting. We came with we decided on 3 values: integrity, respect, and women empowered. Our vision is the Wayne County Women's Commission will be a platform to communicate and raise awareness about the critical issues impacting women in Wayne County. The Wayne County Women's Commission will be a leader in collaborating to make recommendations to advance the well-being of all women in Wayne County. That was our vision. And the mission that we came up with was the mission of Wayne County Women's Commission is to uplift women throughout Wayne County by collaborating to advocate for effective solutions to remedy these issues. These issues include, but are not limited to, gaining access to medical, physical, emotional, and mental health care, financial/business growth, housing, and childcare. And that is what we bring to the body today for discussion and possible approval.
So if we can break these pieces up, since they are in 3 different categories, did you read the core values again? And is that something that this body have a motion to move forward on today? If I can get some feedback.
We do have hands raised from Vice Chair Roberts and Member Dobb.
Go ahead, Member Roberts.
Thank you, Madam Chair. And I really want to thank the committee for all of their hard work on this. 2 things. One, Gagny, do we still have a quorum?
Yes, we do, Vice Chair Roberts. We have had people leave, but I believe we're still at a quorum. I can double check though. Give me 1 second.
Go ahead with your question.
Okay. And then my second point that I would like to make Although I think, this is really wonderful. I believe that this should have been emailed out prior to our meeting so that every member had an opportunity to read this before, taking any action on it today. And my recommendation would be to put this on our next agenda item, have it emailed out to every member so they have the opportunity to look at it, reflect on it. They perhaps may have some input on it, and take a vote on this when we have more of our membership present.
And we do still have a quorum, Vice Chair Roberts.
But we still had a good number of people hop off. But thank you, Dagny.
Well, if we have a quorum, so let's move on.
Madam Chair, I'd like to respond to that statement. These minutes were emailed over 2 weeks ago to various people, including yourself, Vice Chair. So anybody that received those minutes had the ability to mail them out to the membership.
Madam Chair.
Go ahead.
This item was not included in the agenda packet. I didn't personally have not seen this before, so I don't know if other people did. It should have been included in the packet.
Well, did Gagnique have was Gagnique sent the mission and core value statement?
I was Chair Carter. However, I was not aware that this was what we were going to be voting on, so I did not include it in the agenda. I will take responsibility and ownership for that, and I apologize to members who did not receive these via email. I can make sure after this meeting to send it out to every member if we wish to discuss it at a future meeting, but I will defer to the body on what it would like to do.
I have a question.
Who's speaking?
Member Shield.
Go ahead, Member Shield. Thank you.
So when you look at the agenda just says it's an update from our committee. So I'm fine with reporting out that we have completed our role as a committee, and the body can choose to, let's look at this for 30 days until our next meeting. And then on the next agenda, put that we're planning to vote on it so that people know to read this and be prepared to vote.
I agree.
Is there a motion?
We have a hand from Vice Chair Roberts.
Thank you, Dagny. My comments are really about process. I did receive this as Vice Chair, but it is not my role to send this out to the full body.
No, members, all due respect, we're not going to talk process in a public forum. We can have this discussion at a later date. So if you want to call me or we want to create another meeting, that would be most appropriate.
So I'll make a motion, Madam Chair.
Proceed.
This is Commissioner Shield. I move that we accept the suggestions or the Women's Committee's core values, vision, and mission to send out to membership and to take a vote or to receive input from members at our next voting meeting.
I'll support.
Okay, can we get by well, let's take we can do just a collective vote. Is that mission? Excuse me, is that motion supported?
Yes, I supported.
Or are there any objections to the motion to table this until the next meeting? Any abstentions? And hearing none, let's move on to the next category.
We have to vote.
Oh, I'm sorry. Go ahead. Let's go ahead and vote. I thought we said
That's what you were doing.
I think we just did that, right? Did we not?
That's what I thought.
All in favor, say aye.
Aye.
Aye. Any opposed? Okay.
Thank you.
Motion passes. Thank you.
Thank you. All right, so the next item on our agenda is an update from the committee to facilitate a strategic planning process or for the strategic planning.
And thank you, Chair Carter. I'll be very, very brief. Our committee met for a second time. We continued discussions on developing a strategic plan for the Women's Commission. We worked on some items for a potential framework for this plan and talked about the idea of like some areas of focus. We discussed some ideas around how we are interested in getting full input from all the members of the commission. We did not make any final decisions. And so we are meeting again on October 22nd. We will continue to meet twice a month as needed. And I am hopeful that for our next full board meeting next month, we will have some recommendations to report out for the full commission recommendation. Thank you.
Thank you, Member Roberts. Appreciate that report. The next item on our list, we're going to skip over the meet and greet. We've already handled that. So number G is, are there any other matters as may be properly submitted before the board at this time? I will add that along with the updates regarding or the core values and mission and vision statement that will be distributed today, I'm also going to attach to that, Gagny, is the official form that we're going to use when we're inviting guests to our committee meetings. We do want to create a process that everyone can participate. And if you have anyone would you like to invite, whatever the subject matter may be, that may be consistent with our charge as a arm to the Wayne County Commission, you may submit it and you may submit it to me. And if you may do it 2 weeks ahead of time, that means that you're going to be talking 3 weeks ahead of time because you want to solidify the speakers and get the information in. It's probably a lot more we can do with that whole process if we know ahead of time, and we want to make sure we encourage people to bring us great information such as we had today. I want to thank again our illustrious guests who did such a marvelous job and providing us the facts from the source. So I do want to thank them again. At this time, we're going to open it up for public comments. If you're on the phone or if you are on this Zoom, we invite you, whether you are a committee member or not, to make that public statement at this time. Are there anyone with a message or a statement or a question even at this point?
And I did not receive any emails, Chair.
Thank you.
This is Chairwoman Bell. I just want to again thank everyone for your continued participation in this very important Women's Commission. I appreciate the hard work that all of you are putting into this, understanding it is a volunteer organization and you could be doing many more things with your talent and your time, but I appreciate you all taking the time out of your schedule to participate in this, and I continue to look forward to ongoing great conversations and speakers as we had today. So just keep up the great work, ladies. I look forward to trying to meet you all at the meet and greet on next week. Thank you so much. Have a wonderful day.
And thank you, Commission Chair Alicia R. Bell. Thank you so much for giving us all.
Oh, sorry, we do have a hand from Member Crawford.
Correct. Go ahead.
Okay. Hello, everyone. I do apologize. I was transitioning to my car, but I just wanted to say thank you again. Again, I apologize for with the last minute call from Bahama Breeze, but I would love to continue to work with the committee, and I would love for all of us to also be able to support Ryan in efforts to preparing for a wonderful holiday celebration. So we're gonna, if we can, kind of lightly just, come up with some ideas next week or just a meet and greet period. We're not gonna vote on anything, but those who have stated that they're interested in assisting with the meet and greet as well as the holiday celebration, let's please continue to support each other and Ryan in this process. Thank you so much.
And thank you, and to all of our chairs and vice chairs and even our organizers of our activities. Without you, we wouldn't have anything to deliver. So thank you so much for working diligently in your spare time that you don't really have to participate in this volunteer committee.
We do have another hand from Member Douglas.
Go ahead, Member Douglas.
Thank you, Chair. I'm not sure if this is the point in the agenda, but I just wanted to recognize October as Breast Cancer Awareness Month. Chair Bell did issue a resolution this past week for the full board, and it was approved. So I just want to thank Chair Bell for introducing that. Also, October is Domestic Violence Month as well. And I know that some of us may have been affected by domestic violence during this COVID. I know that there's been reports that has gone up during this period, but we still need to be supportive of those women who have been exposed to that. But that is just one of the two things that I just wanted to mention. So I know that we'll be working on some of those issues as well during this time as this commission proceeds on. So I just wanted to bring those two issues up. So thank you for your time.
And thank you, Member Douglas. Is there any?
If I could have just a few seconds, since it is Breast Cancer Month, my sister and my daughter both died of breast cancer. And I just want to take 10 seconds to share this with you. It's a poem that I wrote when my sister was ill. The right to be me. I heard you whisper. I saw you stare. Look, she's bald. That woman has no hair. Some of you made comments that weren't very kind, telling exactly what was on your mind. I smiled and spoke, though I was in so much pain. You stared, pointed, and whispered again and again. I sincerely meant no harm by wearing my head bare. I was just expressing my right as a person with cancer.
Beautiful, absolutely beautiful. Wow. Thank you so much, Member Douglas, for that. Are there any other questions, statements? Not hearing any. If someone may make a motion to close the meeting.
Member Douglas makes a motion to adjourn.
I'll second Sheila.
All in favor, say aye.
Aye.
All that oppose, say nay. Thank you. The meeting has officially ended. Thanks again, everyone. Have a great month.
Thank you.